I am Dr. Malea Jensen, and this is Tucker. Tucker is co-hosting from heaven. So I am welcoming you to Dr. J's Prescription for Health. Welcome, you guys. Happy Saturday. This is your opportunity to ask questions. As a reminder, this is Instagram, and we are also live on YouTube today. This is not medical advice. I am not your doctor, and you are not my patient. It's for information purposes only, maybe a little bit of entertainment sprinkled in. Good morning, Lucy. Good morning, you guys. So as we get started, I'll let you guys ask questions. We'll try to answer as many as we can in the time that is allotted. And usually I do go overtime. Imagine that. You know, when I'm at the gym, I seem to get the most interesting conversations. And it's very enlightening. I do enjoy it. Sometimes it's a text. Sometimes it's simply somebody that's asking me questions in the gym, whether they've heard me speak about something or just simply asking a question, that knowing that I'm a doctor. And so this morning I got into a conversation in regards to fiber. So what are you guys' thoughts on fiber? Touch of Wood, good morning from Dothan, Alabama. Where are you guys listening from? Good morning, Lucy. And Sweet Tucker, I'm ready for class. Good, you got your pen and paper. Awesome, awesome, awesome. So what are you guys' thoughts on fiber? Why do we need fiber? What is fiber? I'm interested. Dallas, Fort Worth. Delgado, thank you for joining. I appreciate that. Fiber is, by definition, indigestible. I want you to think about something, and I'm not going to say one way or another. I need you guys to make your own decisions. I need you to look things up, but I want to ask a question. Babies. You're being told that fiber is necessary, right? Can't live without it. What about babies? Babies that are breastfed. Do they have fiber in their diet? If they don't have fiber, how do you explain the constipation, the irritable bowels? How do you explain all the things that apparently fiber is good for, and and why a baby doesn't need it? You do, but a baby doesn't. I'm just thinking through these things. You know, breastfed babies, they don't have fiber in their diet, but yet everybody else needs it, just not babies. Okay. Roughage is what I was told. You need it for roughage. So just purely from that definition, Delgado, you want to eat fiber to rough up the inner lining of your colon, cause inflammation, cause an injury, causing gap junctions in the endothelial cells, the colon cells. Do we really want to rough up our colon? I'm just asking. I mean, you called it roughage, or somebody called it roughage and told you that's what you need. So I'm going to, why not just eat some sandpaper and let that rough up things in the colon? If it's indigestible, that means it's coming out in our waste, in our stool, correct? So it's indigestible. That means you as a body, Delgado, cannot break down. You can only rough up the inner lining of your colon. You can't break it down. It comes out as waste. So what is really breaking down or trying to break down, if they can, the fiber that you consume or told to consume? What is breaking it down or trying to break it down? The answer is bacteria, microbiome. You're not breaking it down. You can't. You don't have a cellulase enzyme to break down the walls of a plant. The roughage. A fiber is a roughage from a plant. It is a plant. We cannot break down plants. Not even our bacteria can break it down. That's why it comes out as waste. They can suck out the sugar and do the best they can, use that, but they aren't using fiber for anything beneficial for them. I'm just thinking through things. If you have an opinion, tell me, okay? But the reason you have waste is that it's indigestible. You can't use it. There's nothing essential about it if it's coming out as waste. If you eat a piece of meat, none of that meat comes out. You eat a piece of corn and all of the corn comes out. Which one do you think you got the most nutrients from? 99% of meat is digested in the small intestine. Hardly any gets to the large intestine where it is fed on by bacteria and then the rest waste. Lucy asks, can you speak about narrowing the aortic valve? A friend of mine went to a doctor and he heard a heart murmur. She has no symptoms, but after checking, there's a narrow aortic valve. Stenotic is the term for that. So you have stenosis of the aortic valve. She has stenosis of the aortic valve. Okay? That can come from many different things. It can come from blood pressure problems. It can come from vegetation that has grown on that valve. And so the doctor hears a murmur. And it's usually a murmur that's distinguishable from other things. And so they listen here on your heart, and then they'll go up and should go up and listen on their neck. And a lot of times, a aortic murmur will radiate into the carotids. Okay, a murmur is actually narrowing of that flow of blood. So picture a river. When we stand next to a river, if the river is really wide, we can hardly hear the flow of that river. But as we get to an area in the river where it's narrowed, we can hear the water move. It's called rapids. So that's what we're doing on our neck. When we listen for a carotid bruit, that's a bruit, a sound that we hear. You might think that if where the carotid artery is wide, you're not going to hear flow. So it's going to be unimpeded, right? There's no infringement on the blood flow. So you don't hear anything. You don't hear a murmur. If the area of the artery is narrowed, it's going to be like standing beside a narrow river and you're going to hear rapids. So you're going to hear, okay? But what if the artery is so narrowed that hardly any blood flow is going through? You're not going to hear rapids, like you're not going to hear anything. So you're going to be misdiagnosing or lack of underdiagnosing a carotid bruit. But sometimes if we hear it here, and then we also hear radiation into our neck, we go and do an ultrasound. So we get an echo of the heart. And a good doctor picked that up. You should feel very blessed that that person, it got found out. So they're going to go get an echo. They're going to have an ultrasound of their heart, and they're going to look at these valves. And that aortic valve is something that goes bad on a number of people. Why? Could it be the pressure that it's under? Possibly. Could it be vegetation from a prior infection? Possibly. She might not have symptoms right now, but eventually it gets narrower and narrower. And the mnemonic that I use to think about aortic stenosis is a SAD disease. It's SAD. The S stands for syncope, feeling like you're going to pass out. The A in SAD is angina, chest pain. So these people could start experiencing chest pain over time. And then D, dyspnea. That means shortness of breath. So a SAD disease leads to these symptoms. It could take years to develop. And what they do is they just watch it. They may not do anything if she's asymptomatic. Okay? So that is, what I would say about aortic stenosis. Hopefully, does that answer your question? Lucy says, fiber. If you eat a crapola diet, you need fiber to eliminate the waste. If you eat high nutrient dense food, your body will utilize. Perfect, Lucy. So if you're eating, which is the greater extent of the population is eating a crapola diet, a Western diet. They're eating nutrient inefficient fake food. So it's crapola. Good word, Lucy. I wonder where you got that word. So this crapola diet is full of things that you cannot use. There's no nutrients to them. They're nutrient deficient. And so is fiber for those people a good idea? Yes, because it helps to get the waste out of the body. Unfortunately, it's roughing up the colon, causing more inflammation, which is causing more leaky gut or more irritability of the gut lining. This is what leads to polyps. Polyps are early warning signs of cancer. It's the terrain and the things that we're putting in our body that is causing the problem. Okay? Until we really get that through our head that there is no essential carbohydrates. So if you're eating a diet full of carbohydrates, full of fake food, full of processed chemicals, you are setting yourself up. And maybe that's why they recommend fiber. They're not going to tell you about your diet. They're just going to say, well, since 75% of the population eat crapola, I guess we better tell them to eat fiber. I mean, is that what it's coming to? Harry, try to restate your question on dehydration. I'm not sure where you are going with that. DM says, how does cortisol affect skin allergy sensitivity? Well, you got to first, ask yourself about cortisol. We all need cortisol, okay? It's our fight or flight hormone. It is something that we all need. We, unfortunately, are getting an excess of cortisol, I believe. We are in situations that we put ourselves in, and they're high stress. It could be our job. It could be our kids. It could be run, rush. It could be, the foods we eat, the exercise we do. All of these things cause stress. Stress is okay as long as it comes back down. If we are under stress, that's the sympathetic nervous system. If we're constantly activating our system, we can get all kinds of symptoms. Okay, it doesn't necessarily have to be with just our skin. It could be with our bowels. It could be with our eyes. I mean, everything, our heart rate, all these things are from stress, cortisol. Okay. Now, the fact that you're having skin allergies or sensitivities, I'm glad you said that, because not everything is an allergy, but things come out in our skin, and it's usually GI. Okay, you can tell a lot about a person's gut health by looking at their skin health. So it may not be related to cortisol at all, or it might be related to cortisol. So fixing the gut helps to fix our skin. Some of the other things that come out on our skin is, if you have heavy metal toxicity, if you have iron overload, if you are eating foods that you're sensitive to. Again, that's gut. All right. Hopefully that answered your question. Lucy says, sorry, thickening of the valve. Right, sclerosis. So calcification. Something injured her aortic valve, probably in childhood, probably in an infection. Yeah, Lucy, I understood. I was just trying to give you how doctors pick up whether or not it's aortic, aortic valve. I understood your question. Yes, I understand it's not it's the heart and not the carotids. I get it. I was just trying to help you understand what doctors do when they're determining why she didn't have any symptoms and what led them to ordering an extra test. Okay. You guys have questions and not just comments. Put a Q or a QQQ in front of your question. We are live on Instagram and YouTube today. Lifter Dave says keto diets work great. Tell us about that, Lifter Dave. How does a keto diet work for you? Lindsay says, why are oncologists so slow to say you have cancer? Well, I think the fact that you're actually going to an oncologist is that you do have cancer and somebody else picked it up first. I can't answer for oncologists and why they would be slow to say you have cancer. I'm not sure. And what is the definition of slow? At the end of your appointment, 3 appointments later, I'm not sure. Like I said, YouTube's, instead of having me sit here and trying to go over everything, put a Q in front of it. I know you want to comment. You guys are talking to each other. Seed oil, sugar, and high fructose corn syrup, I agree. They're not good for us. Q, Nala says, hope for someone whose thyroid has been removed. Previous thyroid cancer. So Nala, you're telling me that your entire thyroid has been removed? Is that what you're saying? I'm guessing then you are on hormone replacement. You are on thyroid replacement, whether it be T3 or T4. If you are simply on T4, I'm hoping that your doctor is checking T3, free T3, and a reverse T3 to make sure that the T4 that they're giving you is actually converting in the periphery to the active form T3. Okay. We still are getting some questions over here about fiber. I know it's a confusing subject, and I don't want you to get so bogged down on it. I believe that one of the arguments is that it helps with your blood sugar control. And I would agree. But why do you have problems with your blood sugar that it needs to be controlled? That is the question. And so if you do have a blood sugar problem, what is that blood sugar problem? Is that diabetes? Is it insulin resistance? And why? Usually people who have these things have carbohydrate toxicity. They're consuming too much sugar. The body is unable to use it and it's becoming resistant. So the blood sugar goes up, insulin goes up, and you simply add fiber, okay, but why not stop the blood sugar from going up? It just seems logical to me. Now, if you want to continue to consume the sugar, get the diseases from the sugar, and you simply want to take fiber as a treatment, then I'm hoping you have enough information to make that decision. So Nala, yes, she is on Synthroid. So is your doctor checking free T3, free T4, reverse T3? Have they also checked antibodies? I'm still curious, did they remove all of your thyroid or did they leave some? Lucy says, chemo has paralyzed my gut health. Constipation is a problem. They have me on laxatives. Am I damaging my gut health? Should I just eat prunes? I don't know what laxatives you have. Should I just eat prunes, hot coffee? I have 8 weeks chemo left. Your thoughts? That's a good thing. I mean, if prunes help you with constipation, again, you ask yourself why you have anything in the large bowel in the first place. Only things that are, most things that have no nutrients are going into the large bowel where they can be worked on. Increasing your water. Janet says, could glucoferrin help thyroid issues like hypothyroidism or some whose thyroid has been removed like Nala? That's a great question. I'm not sure that I know the complete answer. But thyroid issues in general, you have to trace back what is causing your thyroid issues, okay? It's inflammation, right? Is it antibodies? Why do we have the antibodies? Is it iron that's built up in the thyroid? Did they remove the thyroid haphazardly? Is the cancer, I'm believing she has cancer. Is that what I remember? Nala, was it cancer? Nala says the doctor changed her Synthroid in January and she's gained 12 pounds in 7 months. Yeah, I'm not sure, but could glucoferrin help with hypothyroidism? But what is causing the hypothyroidism? Is it iron overload? Is it inflammation from a poor diet? We got to trace it back. I would want to look at other labs before I made a decision on that. Nala is now cancer-free. Yes, Nala, you have to be more specific. Yes, it was, is your statement. Does that mean, yes, the whole thyroid was removed? Be complete with your stuff so I can understand, okay? Lifter says he lost 45 pounds off of all meds and reversed his diabetes. Lifter, thanks for sharing your story. I think a lot of people would like to be off of all of their medicines, lose 45 pounds, and not have diabetes anymore. John asks, you know anything on hip replacements? Well, ask me a question and I might be able to answer you. Dennis asks, QQQ, what are your thoughts on vitamin C? You mean taking vitamin C? You have to ask why you need vitamin C. Is that you're not getting it from your diet? The people who eat the most carbohydrates will need the most vitamin C. Why? Because the receptors for sugar and receptors for vitamin C look very similar. So sugar could be blocking receptors for vitamin C. I think if we haphazardly take vitamin C, I think we are blocking natural physiologic and biologic processes in our body. So we're going to block our normal antioxidant cascade by taking more vitamin C. Why do we need it? Usually it's a person who's eating a high carb diet. Good morning, Dr. Christie. We're just answering a question on vitamin C. I also think that we've been fed a lot of stuff that vitamin C can help prevent, getting infections in the future. I'm not sure. I think there's a lot of money to be made on selling products and IV injections or IV infusions is what I mean, with vitamin C, NAD, all of these things we've been told, fight immunity. Fight our infections. They build up our immunity. I'm not so sure. I would think that having a natural immune system working normally is in our best interest. I think when we add in synthetic vitamins, I think we are contributing to more and more disease. I think it's a negative. I do not think that we need to be adding supplements. Everybody's different. Everybody's going to have their own opinion. This is just my opinion. If you're eating a diet that is poor in nutrition, then maybe that's the person that needs to take vitamin C and magnesium and D and all these things. So you have to do what's best for you. Lifter Dave also said he gained 10 pounds of muscle. Is that from lifting weights? Jack says there is no requirement for fiber at all. Jack is under the impression that fiber is a carbohydrate. It is, it's a plant, and that there are no essential carbohydrates. Therefore, there is no requirement for fiber. Dr. Christie says, some people think vitamin C is squeezed and isolated from the orange. It's important to recognize these synthetic vitamins are engineered in a lab to have higher affinities for receptors and are metal. What is metal, Dr. Christie? Oh, I'm sorry. Are metabolized differently, will eventually cause disruption. So Dr. Christie is under the impression that since synthetic vitamins are engineered in labs, they are synthetic, they're not natural, that they will have higher affinities for receptors and are metabolized differently. So what she's saying is the natural vitamin C that you're going to get in your meat or your whole foods is not the same as a synthetic vitamin. You may or may not be able to use a synthetic vitamin, and it might disrupt normal biologic processes in our body. I would agree with that, Dr. Christie. I'm just trying to read you guys' questions. There's a lot of them coming through here, so. Lifter Dave says, doctors check blood sugar, but they're not checking insulin levels. I would agree. Dave, I think that doctors are getting more and more on board with checking insulin. I'm just not sure that they know how to interpret that or why they're checking it. I think doctors are still, yes, I think they're relying on blood sugars. You see, the blood sugars are going to be normal could be for years. So when a doctor gets a chem panel, a blood sugar will be there. And if it's less than 100, according to the reference range on the labs, the reference range will say, if it's less than 100, you're fine. Well, remember, that's a reference range. So it's measuring all of the people that come into the lab. And most people that come into a lab are sick. So we are comparing ourselves with a bunch of sick people. So blood sugars of less than 100 could be a setup that's telling you that you already have underlying diabetes or prediabetes. All right. So we need to be, one, narrowing our range that we're thinking is normal. I believe a range of 70 to 80 is a normal blood sugar in a fasting state. If it's above 80, we need to start looking into things. And here's where the doctors fail, is they'll look at your A1C. And if the A1C is, in their case, below 7, that is according to the American Diabetes Association, that less than 7 is still okay. That is not. That person has diabetes and they need to be treated or told that they have diabetes and they can make decisions. Now, if a person has a blood sugar that the doctor says is in the normal range and they're not checking insulin, you see, insulin, when it's elevated, is having to work really, that tells me that the body is working really hard to keep your blood sugar below 100. An insulin level above 5 is telling me that insulin is being secreted from the pancreas and trying to lower blood sugar. And if it has to be elevated like to 20 to keep a blood sugar of 100, that person has diabetes. And we're not diagnosing that. We're not even talking to the patient. So yes, I think all doctors should get, yes, a fasting blood sugar, yes, a fasting insulin, and an A1C. You can also get a triglyceride. You can tell a lot from the triglyceride level. Be cognizant of the fact that insulin is, it changes through the day, just like cortisol levels, okay? So we can't put all of our chips on an insulin level, but it is a great tool to use in order to determine risk factors of diabetes. There's other ways to determine whether a person has insulin resistance. I mean, just simply looking at the person, you know, what does their body habitus look like? What does their skin look like? We can tell a lot by these things, all right? So good point, Lifter Dave. I appreciate that you bring that to our attention. You know, simply looking at our blood sugars, exactly. They can look normal. And insulin can be skyrocketing just to keep those blood sugar levels normal. Exactly. So Dave has gone to great lengths to try to educate himself on diabetes, on these things. This is metabolic health, you guys. And your doctor, unfortunately, doesn't know these things. And if they do, then maybe they're not telling you. Here's a question. What are my thoughts on MCT oil? I think that we need C8. I believe that there is a time and a place for MCT oil. I don't know what, is it in relation to a specific diagnosis? Tell me your thoughts on why you asked about MCT oil. I have patients that are taking MCT. They may or may not be getting adequate amounts of fat. They might not be eating any animal products. These people need fat for their brain. Giving them MCT oil in the form of C8, carbon 8, is something that will help their brain, something that will help their body. Dr. Christie says, doctors are still relying on ferritin for iron deficiency anemia diagnosis. Well, Dr. Christie, I think both you and I know that iron deficiency anemia is a diagnosis that a majority of times is made wrong. They are making that diagnosis by looking at a hemoglobin or a hematocrit. They're using the word anemia wrong. It's a word that is being abused. Anemia, when people hear anemia, the first thing that goes to their brain is that I need iron, and they go and take iron. That's a synthetic vitamin where, again, something synthetic, man-made. It's made in a lab, so it is synthetic. It's not naturally occurring in our body. If people understand, if doctors were to understand that there is a difference between non-heme iron and iron, we might be able to make better conclusions. So if you're giving enough information, we can make a better decision. If you're being told that iron or anemia is iron deficient and you simply go take more non-heme iron, you might have an overload of iron. So iron is either heme from animals, heme iron, or it's non-heme iron from plants. We cannot absorb non-heme iron, maybe 3%. We can absorb about 30% of heme iron. We need iron in our body for biologic pathways. We need it. We would not do so well if we did not have iron. We would not be able to carry oxygen to your brain. But we are calling something that it's not. And what Dr. Christie is saying, that doctors will use a hemoglobin, they'll use a hematocrit, and then they'll just get a ferritin level. They won't get anything else. If the ferritin levels come back low, they're going to think they have iron deficiency anemia and give that person more non-heme iron. If the non-heme iron is not usable, not absorbable, 3%, it's stuck somewhere. It's stuck in tissues, like that thyroid we talked about earlier, like the liver, like your skin. And so if this labile, non-absorbable, non-heme iron is running freely in our tissues and getting into our cells, and the ferritin level is low, that just means that that iron is stuck in the tissues, and the ferritin is low. It's not, doesn't have bound iron. This person is likely a person who has hyperhepsidonemia. Emia, blood, hepcidin, high, hyperhepcidin in the blood. What could be a problem with that? Well, there is a normal elevator, a normal pathway, a normal protein called ferroportin. Ferroportin allows bound up or stuck, let's say it's stuck iron in our cells that's not usable. It allows transfer from inside the cell to outside the cell. If it comes outside the cell, ferritin can pick it up, bind it, and do its thing. But if ferroportin is damaged, then all of the non-heme iron can get trapped in cells because there's no elevator to bring the trapped iron to the surface. That's what ferroportin does. It can't do that because hepcidin is high. How does hepcidin get high? Liver. The liver is backed up. Hepcidin goes up. Hepcidin affects the ferroportin. Ferroportin affects the trapped iron. It is a vicious cycle. And so a doctor who simply is looking at a ferritin level or simply looking at a hemoglobin or a hematocrit, they could be missing some underlying things. And that's why people like Dr. Christie and, other, I don't know exactly who, but there are people who simply just study iron. And Dr. Christie's going, yes, yes, yes. Okay, so it's people like Dr. Christie that if you think you have a problem with your iron and you've been told you have iron deficiency, you really need to hook up with somebody who can read your labs. And Dr. Christie, is one of these people. All she does is study iron. I mean, she is studying, she's reading, she's going through. Dennis says, just tried to follow you on YouTube. It has a lot of spam and non-related chats, switching to Instagram. I realize that, Dennis. I've noticed that over time. I feel for the people who are on YouTube and they really have questions to ask, and they are important questions, but we're going to, mainly stick with Instagram and the questions because there is a lot of extraneous things going on over on YouTube, but eventually we'll weed them out, Dennis. Eventually, over time, we will weed them out and we will get similar to Instagrammers who really want to heal. They want to understand what's going on in their body. All right. Back to Dr. Christie. Report the spammers. Get them out of there. I agree, but you know what? That takes too much energy, and I'm actually giving credence to somebody that doesn't deserve my attention and energy. They'll go away. I'm not worried about that. So getting back to the iron studies, if you have concerns in regards to your iron, there are, you can go to Dr. Christie, you can go to Peter at Glucoferrin, you can go to Dana, and you can go to Baker Family Fitness. There's a lot of people who are studying iron. I study it, but it's just that I have other things that I want to talk to you guys in regards to other health issues. You guys have other health issues. Could you say that everything stems from iron overload? If you ask yourself about iron and the implications of having trapped iron in your cells, you will understand why your liver doesn't work very well, why you have cholestasis, why you have backup, why your bile doesn't work, why your gallbladder sucks, why your thyroid doesn't work anymore, why your skin has brown spots, why your eyeballs are getting cataracts. You see, iron could be the underlying component to all of this. Could it add to insulin resistance? Absolutely. Could it add to every disease, chronic disease process that we have going on in our body because it increases our risk of oxidation, peroxidation, reactive oxygen species, and then you simply just go and take more vitamin C to try to bump things up? But you continue your crapiola diet. You are low in amino acids. especially the sulfur bonded amino acids, methionine and cysteine and taurine. And how do you make glutathione, which is the master antioxidant? You need those amino acids, those sulfur bonded amino acids. You need methionine to make glutathione. How do you get cysteine, which makes methionine or converts to methionine or allows conversion to methionine? Eating amino acids. Where do you get those? Animals. Plants don't have them, unfortunately. So if you are not eating meat, you're going to have to supplement. Janet asks, how many hours should we fast before getting our glucose and insulin checked? 12 hours, 10 to 12 hours. Could natural rise of glucose that happens when we wake up give us unreal results or abnormal results? Or yes, absolutely, Janet. That is a very good question. Thank you. Actually got that question asked by Lucy yesterday. Yes, when we wake up, okay, the reason we wake up is because we have cortisol. Cortisol naturally rises in the morning. It is a natural occurrence to try to get you ready for your day. So around 3-4 a.m., we get a spike of cortisol. If you have a spike of cortisol, your blood sugar is going to go up. And so this freaks out diabetics because they'll check their fasting blood sugar right when they jump out of bed, and their blood sugars will be elevated, and they're going to say, why are my blood sugars? I haven't even eaten anything. Because of cortisol. So should we check our blood sugar and our insulin and our labs at 7 or 8 a.m. in the morning? Probably not. We might want to wait till 10 or 11 when cortisol is starting to level off. So if it spikes around 3-4 a.m. and goes up till around 9 a.m. and then levels off and then around 6 p.m. starts to go back down, you might want to check your labs later in the morning instead of earlier. Now, that plays a role in how many hours you're fasting. Because if you go to bed at 8 o'clock at night and you wait till 11 or 12 to get your blood levels checked, you could be fasting more than 13 or 14 hours, and that could skew your results. So it's a touchy thing about getting your labs. But what I do recommend is when you check your labs, check them at the same time every single time. So if you go at 10 a.m. this time, go at 10 a.m. each subsequent time, because it's going to be more accurate for you and your labs. So if you have a high fasting blood sugar this time at 10 a.m. and then you start going on a low carb diet, low in sugars, you are going to possibly or hopefully have lower or better results at 10 a.m. in 4 months or whenever you check your labs. Yeah, Dr. Christie says be consistent with getting your labs checked the same time. Good morning, Jim. Thank you for joining. My insulin level is 5.6. A1C is 5.7. Glucose is 83. What should I do? What do you mean, what should you do, Mirror? What do you mean? Dr. Christie says, get your iron studies. Are you talking to Mirror or are you just talking in general? I agree. Get your iron studied. What does that include? An iron level, for one, a ferritin level, a transferrin level, a TIBC, a iron saturation. You might want to get a protein S. That would be indicative of a lot of things. So have Dr. Christie look at your labs. And I'm sure she's got the perfect fix for your labs as well. Finding out that you have iron overload is really important. I would venture to guess that 95% of us have non-heme iron overload. And we've chalked up all of our symptoms, all of our chronic diseases, to just system-oriented checks. Let me give you an example. We have a lung problem, a breathing problem, you go to a lung doctor. You have a urology problem, a pee problem, you go to your urologist. You go to your gynecologist, your hematologist, your whatever allergist, rheumatologist. You're going to a system manager. that no one is putting all the dots together. No one's putting the pieces together. No one's figuring out the puzzle. They're all just treating their system. And they're usually treating it with medicines, chemicals. So if you recall earlier, I said that most diseases, most all symptoms are a defense mechanism. Your blood pressure is not a disease. It's a defense mechanism. Something's going on in your body, and the defense is to raise your blood pressure. Your cholesterol is high as a defense mechanism for something that's going on in your body. It's not the cause of something going on in your body. It's a defense mechanism. So you go to the doctor, and the doctor will put you on a chemical to lower your cholesterol, thinking that that's what needs to be done. I don't know why. Ask the doctor why that needs to be done. The controversy. Well, I thought it helps with prevent a heart attack. If it prevented a heart attack and 90% of the population is on statins, why are we still having heart attacks? Good question. Oh, it's not low enough? We need to lower it even more? Well, I've seen some people with a 20 cholesterol, LDL of 20, total cholesterol of 80, 70. They still had a heart attack. Is something else going on that's causing heart attacks? Why do we rush to the doctor? As much as I love testing, because I think it helps a lot of you, I really do. I think knowing your numbers helps. But the minute we test, you're not going to Dr. Christie, you're not going to me. The minute we test something, it's called a diagnostic. We use a diagnostic to make a diagnosis. When we have a diagnosis, you now become a patient, and now there's a treatment plan. That treatment plan by most doctors, I'm going to paint with a big, broad brushstroke here, will put you on a medication, a chemical that will block a normal biologic process in your body. They don't usually work with your normal biologic process, unless, of course, you take an agonist. For instance, you are overweight, you have obesity, and you take a GLP-1 agonist, receptor agonist. But that GLP is in super physiologic doses. So it is higher than our normal body production of that GLP. We've never done studies on super physiologic doses. You guys are the guinea pigs taking those medicines. But most block, they're antagonists. So they're going to, like a statin, they are an HMG-CoA reductase inhibitor. They're inhibiting the reductase of HMG-CoA. Reductase is an enzyme. Enzymes are needed to break down things in a process, okay? So if you block the reductase of HMG-CoA, you're saying, or the doctor is telling you, that you don't need anything else downstream, including cholesterol. If they block HMG-CoA reductase, then they are not getting anything downstream, including cholesterol. So they're essentially telling you that you don't need cholesterol. And you know darn well that you do need cholesterol. How are you going to make hormones? How are you going to make vitamin D? How are you going to make testosterone and estrogens? Every cell in our body has cholesterol in it. It's the cell membrane. If you didn't have cholesterol, you would fall like a heap on the floor. You will get sick first, okay? Then you're going to fall like a heap on the floor, and that's called death. All right? So the fact that the doctor is telling you that you don't need cholesterol, and you bring this up to them, they'll say, which is worse, having a heart attack or having no brain function? What else downstream is HMG-CoA reductase blocking? Well, you don't get CoQ10. That pathway makes CoQ10. Oh, I don't need it. Okay. Well, you don't need vitamin K2 either, right? You don't need any of the other things that are made downstream when you block HMG-CoA reductase. These are the things you need to ask yourself. We're getting side effects. If there's no cholesterol in it for our cells, what is our brain going to do? That's why there's a risk of dementia, Alzheimer's and MS and all of these things. It's not from, the statin didn't cause dementia. You don't like take a pill and you get dementia. It's the effects that no CoQ10, no vitamin K2, no cholesterol. That's why there's increased risk. If you don't have those risks, hallelujah, okay? But you have to ask, is the risk outdoing the benefit? And really, what is the benefit of a statin? What is the benefit of a statin? It's not simply just to lower cholesterol, because heart attacks are still happening. The reason, and the doctor doesn't tell you this, is what is the benefit of a statin? If there is one or two, what is those benefits? Number one, a statin has been suggested to be anti-inflammatory. So the doctor, if they know that that's a benefit of the statin, are admitting that inflammation is a problem. Okay? They're admitting to you by putting you on a statin, if they know the real mechanism of action of a statin is to decrease inflammation, then why didn't they tell you to stop the inflammation or tell you what causes inflammation in your arteries? Why didn't they give you informed consent? Yes, a statin is anti-inflammatory. But what is more anti-inflammatory than a statin? A ketogenic diet. Ketones are anti-inflammatory. Now, what is the other benefit of taking a statin? Clot formation. It decreases clot formation. So, if your doctor knows that and they put you on a statin, they are admittingly telling you that clot formation is a cause of heart attacks, not cholesterol. Clot formations and inflammation. Did the doctor tell you how to avoid clots? Likely not. When an artery gets inflamed, blood can become stagnant. Can clots form? Absolutely. It's inflammation. It's inflammation and clots. Exactly what the statin is really used for. But in the process, it's stopping everything else, including vitamin K. Remember, I told you that HMG-CoA reductase breaks down in the mevalonic pathway into vitamin K, including K2 and K1. What does K1 do? Makes our blood move a little easier through arteries. We could consider it as a thickener or a thinner, right? So if you have very, very thin blood, your INR is high, it's above 2, you're on a blood thinner, what do we give patients to reverse that INR, to thicken up their blood? K1. We are messing, my point is, we are messing with biologic and physiologic processes in our body. Okay? I missed a whole bunch. We get into the statin thing. I'm not going to tell you what to do in regards to a statin. I just want to provide you with information that you can take back to your doctor. There are reasons why we need cholesterol. There are reasons why we need vitamin K2. If we don't have K2, then we lose a benefit of K2, which is drawing calcium out of arteries and putting it back into our bones and teeth. That is one of the functions of K2, and that's why you guys are taking D3K2 as a supplement, is because you've heard that K2 will help decrease plaque formation. What is causing the plaque formation? Plaque formation is simply and injury prevention. You got an injury and the Band-Aid is the calcification. That calcification includes some cholesterol, it includes some red blood cells and some platelets and white blood cells and all kinds of debris that form that plaque, that calcification. And so if calcium is part of that calcification, K2 is needed to draw that calcification out. But if we block that mevalonate pathway, our K2 production goes down or non-existent. So we've just eliminated a natural biologic process that helps keep calcification out of our arteries. With that being said, the very fact of aging could increase calcification. You are inflamed and you're going to calcify. Statins, did you know, increase calcification? People who go on statins get more calcification. Their calcium score will go up just being on a statin. Has anybody ever brought that to their attention to their doctor? Well, yeah, but that's not the same calcification. Well, if it's not the same calcification, how would you explain that? Doctor, how do you explain that? Should we be doing something different that's not causing calcification? Maybe, like stop the injury. Well, what is the injury, Dr. Jensen? Sugar, insulin, nanoplastics, heavy metals, smoking, alcohol, iron overload, niacin. That's just to name a few. And we do these things every single day, right? You're eating stuff in the ground that's full of heavy metals. You're drinking city water, heavy metals. You're living in a polluted city, heavy metals. You're drinking out of plastic bottles, nanoplastics. All of the things plastic that you put, what about your toothbrush, the bristles? Everything. Can we live in a bubble? No. But simply taking a statin and thinking it's going to prevent you from having a heart attack? You guys, I really think that we should reevaluate. I really do. I think that if the number one cause of a heart attack, we said is inflammation, we say is blood clot, and what is the biggest cause of inflammation? Diabetes. They'll even tell you that diabetes is the number one cause of a heart attack. And so everybody who's got diabetes is going to be placed on a statin. Do you see the irony here? They never even told you to stop your diabetes or how you could stop your diabetes. Diabetes is, the other name for it is carbohydrate toxicity. So do you just keep, if a fire it needs kindling or it needs gasoline, do you keep putting kindling on the fire if you want it to go out? No. So if you have diabetes, do you continue to kindle it with carbohydrates? If you already have toxicity of carbohydrates, and you have diabetes, why do you keep consuming them? Wouldn't you simply stop? Anytime we eat anything, we get inflammation. Anytime we get an inflammatory reaction. But people who eat carbohydrates eat multiple carbohydrates through the day. They're eating small, frequent meals. They're causing elevated blood sugars through the day. That raises insulin. Makes sense? Insulin and blood sugar and heavy metals and nanoplastics and all of these things are leading to an injury of the vascular wall inside the artery. The first part of it, the glycocalyx, is damaged. That's the innermost lining of our artery is the glycocalyx. It's being disrupted. That jelly-like material lining our arteries that makes things slip on through, your blood cells, all of it. If we disrupt that glycocalyx, everything gets roughened up. And then we are on a high sugar diet, or we're smoking. We have nicotine and tobacco and any plant that's smoked. Right? The burning of any leaf is causing toxicity. But yet we'll get lung problems, we'll go to a lung doctor and they'll just give you a medicine. They'll tell you to quit smoking, but are they really telling you what is going on? That You have a lung disease, now you're going to have a heart disease. You have a heart disease, now you're going to have a renal disease, a kidney disease. It's all tied together. We're not connecting the dots. We're getting specialists. You go to this specialist and that specialist and blah, blah, blah. It's hard to see, you guys. I'm going to try to catch up. Dr. Christie says, oh, the diabetic. I'm pre-diabetic with those results. At 5.7, you are. But I don't even know what diet you're on, Mir. I don't know what diet you're on. You could be on a carnivore diet. Are you on a carnivore diet and you have an insulin of 5.6, which is great, and an A1C of 5.7 and a blood sugar that's between 70 and almost 80, right? That all sounds really, really good. Are your red blood cells lasting longer because you're on a carnivore diet? Are they aging gracefully? They're going to have an increased time to be glycated. Glycation is a sugar binding to a protein, any protein. In this case, an A1C is measuring glucose binding to the protein hemoglobin. Hemoglobin is the protein. Glucose is flowing through your bloodstream. Glucose in the bloodstream binds to hemoglobin, and we get a measurement, a magical measurement called an A1C. The A1C it's not always accurate. Other things can confound that A1C. It could be higher in a case of a carnivore. It could be higher even in a case of somebody who's on HRT, hormone replacement therapy. So we have to look at more than just your insulin level, your glucose level. We need to look at triglycerides. And Dr. Christie suggests getting your iron studies. The iron could be affecting your pancreas. So yes, Mir, by all definition of prediabetes, a 5.7, 5.8, and 5.9 is prediabetes. Dr. Christie says your iron could be, get your iron because it could be affecting your pancreas. But in this case, yes, I agree with you, Dr. Christie, but her insulin level is 5.6, well within a range that we would consider a normal acting pancreas. Could you still have iron in that? I'm not saying yes or no. I'm just saying think through it logically first before we say, oh my gosh, well, the iron could be affecting the pancreas. Well, if it's affecting the pancreas, the insulin would be affected. In this case, hers is not. Dennis says, when testing your own glucose and ketones, should you test at 10 a.m.? I think a great time to test is between 10, 11, 12 to get accurate, readings of your glucose levels. Retail My Ride says, Dr. J, I need to get with you this week to order next round of labs. Last time was in March, so that was in 3. It's already 8. So yeah, it's been 5 months. Yes, that would be great. So for those of you, that brings me up a good point. I do consultations with my listeners. If you want me to go over your labs and give a breakdown and help you decipher, decode what your doctor is not telling you, I'm not replacing your doctor. You need your doctor. I'm just giving you more information to take back to your doctor and ask questions, good questions. Now you're going to be equipped with information that you can have good discussion with your smart, educated, knowledgeable doctor that never went over your results before. But now that you're equipping yourself with more information, you're going to force them to go over your labs with them, okay? With you. It's amazing. You start pressuring somebody to go over things. And then if they don't want to go over that, please have them document you want a copy of it. Please document that you do not want to take the time to go over the labs with me. Please document my chart. So in case something in the future were to happen, I have the documentation that you did not want to take the time to go over them. If it's not a time factor, please put in the document that you didn't know the answer to my question. And I'll wait while you do my chart. Well, that could be 5 o'clock. I'll come back. I will come back at 5 o'clock tonight to get a copy of my chart. In fact, I could come back tomorrow morning if that would be a little less pressure for you. But I want you to have documented why you don't want to go over my labs, that you simply just had your nurse call me and tell me that my labs look good. You mean like all of them, nurse? And what does good mean? What is the definition? Well, there's no red flags. Okay, what is a red flag? Well, they all look like they're in the normal range. What is the normal range, nurse? You mean that reference range? Is that what you're calling normal? That's not normal. That's a reference range. A reference range is everybody who comes in. That's the average of everybody who came into the lab. So you're comparing me to everybody else? No, I want to be me. I want you to tell me, oh, then you're going to have to make another appointment. Good. Can you schedule me? Let's do it. Let's make me an appointment. I'll go over them with the doctor. I want them line by line. Read them. What is normal here, doctor? Well, here it says right here in the reference range. No. What's optimal? Well, right here. No, it's not. This is what I do, you guys. I go over everything and I equip you with information so you can take back to your doctor because you need them for something. So yes, if you would like to have a consult with me, just email me at IronLadyDoc@AOL.com. IronLadyDoc. No, I never studied iron before getting my name. I've had my name Iron Lady Doc because I am a weightlifter, and that name was given to me by my friends. They called me the Iron Lady. And then when I became a doctor, they extended it to the Iron Lady Doc, and that's how I got my name. Weightlifting, not iron studies. Although now it really rhymes it really relates with the study of iron that I find very passionate, but not maybe as quite as much as Dr. Christie finds studying iron passionate. Okay, Dr. Christie is also encouraging Mir with the A1C. You can check antibodies for type 1. I don't really necessarily think she needs to have her antibodies checked for type 1 diabetes because she still is producing insulin. If it was 1, her insulin level was 1 or 2, I would maybe check it. But at a 5.6, if that level was accurate, I don't think I would waste my time with diagnostics. You're going to end up uncovering things that are maybe over-diagnosed or something. Listen to you guys. Whenever you get tests, that's called a diagnostic, okay? That is a diagnostic test, whatever it might be, blood, imaging, whatever it is, urine, okay? It is a diagnostic test. A diagnostic test makes a diagnosis. When you get a diagnosis, you now become a patient. And usually that indicates the need for a treatment. In this case, a chemical. All chemicals are likely to be blocking normal physiologic and biologic processes in our body. Okay? Dr. Christie says you still have a good amount of insulin, so probably no antibodies. Check. Okay, I'm just getting to that. So you're actually answering your own question, Dr. Christie. So check iron, transferrin, TIBC, ferritin, CBC, consult with Dr. J or someone who understands and interpret iron studies. And so I'm going to give kudos to Dr. Christie because she also studies iron and reads iron studies, okay? I am very equipped to go over all parts of your labs. If you just are concerned about your iron, I can do that, but so can Dr. Christie, okay? Mirror says, I might need more iron. Well, it depends on what iron you need. I would say that you do not need non-heme iron. You don't want to put more non-heme iron in your body because that is the problem, Mirror. You want heme iron. Where do you get heme iron? Animals. People have been told not to eat animals. Why? Because of saturated fat and cholesterol, as if those are bad for you, when I just got done telling you that cholesterol is needed for all of our bodily functions. We need cholesterol. You wouldn't have nerves functioning very well if you don't have cholesterol, because what makes the myelin sheath around your nerves? Fat and cholesterol. This is an opportune time to discuss these things so you are equipping yourself with more knowledge, okay? It's not that you guys are reading something like this morning I had a patient or a client ask me, I thought you told me that red meat is good. I did say that. Well, this article says that red meat is not good. Well, what's it not good for? Did you read the whole article? Who did the article? What is the financial backing of the article? Everybody's going to have an agenda. You can't go anywhere in the internet without finding somebody for or against your something. But Mir's asking, I might need more iron. You might need more iron. You might need more heme iron. Is it possible that you could have iron overload of non-heme iron? All of it's trapped in your cells. Your ferroportin is broken. Your hepcidin is high. Your liver's not functioning. Could you have an overdose of non-heme iron affecting all of the cells in your body, causing rusting? Do you want to rust inside your body? That is a problem. Everybody is rusting in their body. We call it aging. It's oxidation. It's glycation. It's aging. We are aging in our body. You don't add more fuel to the fire. So are you going to add more non-heme iron? No. That means don't eat plants. Plants are full of non-heme iron. Don't take synthetic vitamins. That's non-heme iron. Stop using cast iron pans. That's non-heme iron. Non-heme iron is the problem. Heme iron is not the problem. You could be deficient in heme iron. Should you eat more red meat? Absolutely. Then you're going to get your B12 and your folate that you need as well, which are cofactors needed for your brain function, along with the cholesterol. So stopping eating fat, we were told to, has caused a lot of problems. But are they really worried about that? Because they could sell you the statin, and they can sell you the diabetes medicine, and they can sell you the brain medicine. They can sell you all these medicines. They don't make money not selling you the medicines. They don't make money when you guys are healthy. They only make money by convincing you to do a diagnostic test. Ooh, I feel something. Ooh, I'm going to diagnostic test you. Ooh, it's this. Ooh, you're a patient. Oh, you need a treatment. Usually a chemical. Did they tell you to stop doing whatever you're doing that caused the thing? No. No. Dr. Christie says, no, just the opposite. You might have non-heme iron overload affecting your pancreas, or you might be metabolically healthy and red blood cells living longer. Exactly. What's your triglyceride? What's your HDL? Exactly. Hello, Brian. I haven't seen you for a while. HDL 57, triglycerides 62, LDL 140. Mirror, just by looking at these things, you look great on paper. What is the problem? So these are good results. Dr. Christie's saying, yep, you need more digging. Right, consider consult with me. I can just look at your stuff. Mirror, please, don't have the frown upside down look. You are fine. Your body is fine. You just want someone to look over and reassure you that everything is fine. It's most likely fine. We're going to nitpick. Anytime we get a diagnostic test, guess what? There's a diagnosis. If you give me any of your labs, I will find something wrong with it. I'm going to find something wrong. But the difference between me and some other 90% of the other doctors out there, painting a broad brush again, but they seem to be opposite of me. I'm going to give you natural ways to change things. Your cholesterol is not the problem. The triglycerides could be the problem. The HDL could be the problem. Your diet could be the problem. Your lack of sunlight could be the problem. Your overdose of EMF could be the problem. Your overdose of blue light could be the problem. Your no sleeping could be the problem. All of these things could be the problem. And you're just going to listen to the doctor who says, oh, your LDL's 140. Here's your statin. Telling you you don't need brain function. You don't need cell structure. You don't need your hormones. You don't need vitamin D, to name a few. You also don't need CoQ10 and vitamin K2. I don't know if I would risk that. Dr. Christie says that's pretty good. Just have to consider the big picture. Diet, exercise, meds, supplements, and always to get iron studies. But if you're eating a carnivore diet, your RBCs might be living longer. Exactly. So A1C is falsely elevated. Exactly. Okay. Mira says, I will be consulting with you both soon. Awesome. We will look forward to hearing from you. I eat mostly meat, but not a strict. Okay, that's great. And when you say meat, do you mean red meat? Because I'm going to tell you, the most important meat that you should be eating is ruminant meat. If your meat is eating plants and I'm telling you not to eat plants, what about the cow? Well, I'm glad you asked, because they have a multi-chambered stomach. The ruminant animals have multi-chambered stomachs. They are going to deal with their natural species food to make you a natural species food full of nutrients. Okay? So yes, does Dr. Jensen eat plants? Absolutely, I do, as long as they're filtered through a cow or another ruminant animal. Those ruminant animals are cows and bison and buffalo and elk and sheep and lamb. Those. Deer, yes. Dr. Christie says, pressure them to do their jobs. Diego says, Dr. J, medical lab evaluation rock star. Thank you, Diego. I appreciate that. You're very kind, Jeff. I really appreciate it. Jeff is somebody who we go over his labs on a regular basis. He doesn't just get my opinion either. You know, Jeff actually consults with other people. Okay? He's getting second and third opinions. He wants to be knowledgeable. He wants the most information so he can make the best decision for himself, for Jeff. He's not just sticking to one person, but it seems we get it in our head that whatever a doctor says or whatever a paper says, that it has the ultimate 100% no fail to it. Impossible. We are humans and we cannot be trusted. For the most part, our heart is deceitful. Now, I am a child of God. I work very hard to cleanse my heart and my thoughts, but I'm not sure that I can say that about everybody. And so money, lust of the eyes, lust of the flesh, and the pride of life come into play. So it's not that Jeff doesn't trust me. He wants to just make sure it's fine. Do it. Get a consult from somebody else and then put all of the things together. Connect the dots, you guys. There's going to be some people out there who are not going to agree with things I say. It's fine. That doesn't make me wrong. Just because you don't believe what I say doesn't make you truthful and me not truthful. Just because you don't believe does not equal truth. Your belief does not equal truth. Look it up. Use your brain. Use the logic. I had somebody ask me today. I put in a comment in a post. I said, this study, I gave the title to the study. I gave the title. I did not give a link. And I said, this titled study says this. And you know what? Somebody came up, they commented, they said, give me the study name. Show me the link. You guys, at some point, you can use the internet as easily as I can. You have to start using your brain. Nobody needs to spoon feed you. Use your brain. It was given to you. Start using it. Think logically. You have been made into a robot, into somebody who has been bamboozled with buffoonery for decades. They tell you, you say, yes, ma'am, yes, sir. Don't eat red meat. You didn't even ask why. You didn't ask why. They just said it'll cause a heart attack. You didn't even think whether or not heart attacks had stopped by taking this or stop eating red meat. How many people do you know that stopped eating red meat and got a heart attack? I can name one really, really close to me. My dad. He even took the statin. He even took fiber. He even stopped, he even started eating sugar-free stuff because they told him that sugar was bad, which I'm glad they did. But they didn't tell him sugar-free stuff was bad. They didn't tell him that the fiber, I mean, he was eating a lot. I would bet he was eating 30 or 40 grams a day. More fiber, better control of your cholesterol. Plus he was taking a statin. He had absolutely no cholesterol in his body. I'm kidding. I'm exaggerating, of course. His cholesterol was so low, and he was wondering why he was a little fatigued. Hormone production, like 0. I checked his testosterone. I just wanted to be, I was curious. We're doing that to our parents. I just thought, well, if I just give my dad some testosterone, he'll be fine. This was me. I was on board with all the statin stuff, all the no red meat, all the no fat. Don't eat fat. It'll make you fat. I was on board. I remember a patient coming to talk to me. It must have been 4, 5, maybe 6 years ago. I bet it was at least 6 years ago. He told me that he only ate meat. And I was used to extreme dieting, extreme diets. I mean, I was a bodybuilder. I was eating extreme. But when he told me that he only eats meat, I said, like, what? Like, what meat? Just steak. I ate some hamburger. Well, of course, in my brain, I thought that was a little peculiar. But I didn't say, I said, how do you feel? I feel great, he said. I go, okay. I got his cholesterol, it was sky high. I said, do you want a statin? He said, no. I said, okay, I guess we'll go with it. I mean, I had no real thought process on it. In the back of my head, I thought, well, if the guy goes out and has a heart attack in the parking lot, I guess I know why. That was my thinking at the time. So do you think that I would have thought any different than my dad stopped eating red meat, go on a cholesterol medicine at high dose, eat sugar-free, and plaster himself with a bunch of fiber? I guess I didn't really start questioning things until my dad died. It took the death of my dad to really get my eyes to open up. Could there be something else? Could there be something else out there? And could my dad's conditions have been caused by no fat diet, no red meat diet, all plants, a statin, and he ends up developing Parkinson's disease? In fact, the only thing that he and my mom have in common, they both have Parkinson's. The only thing that they have in common is a statin. They're both on statins, or were. I mean, that seems really peculiar. So do you just read the studies that say, you know what? Statins don't do that. Or do you like look at all the people around you and say, you have Parkinson's. Oh, are you on a statin? Oh, well, you are? Okay, there's 1, 2, 3, on and on and on. Do you have diabetes? Why do you have diabetes? What are you eating? So, you know what? I take it back. The other thing that my parents had in common, they both ate carbs. Now, my mom, processed crap. My dad, I guess this was processed too. He was eating sugar-free ice cream. And he was eating cereal for fiber because they told him he needed fiber. So he probably had 2 for sure, shakes of ice cream and fiber and some flaxseed. All of these plants, all of these sugar-free things, but they're all carbs, they're all processed. So there's 2 things they have in common. Processed crapola. He even ate rice. I wonder if he had arsenic toxicity. He had to have had iron overload. Never checked, never knew to check. These are the stories. We all have these stories. We can look back and say coulda, shoulda, woulda, or we can move forward and look at things with a different eye. Okay? Look at it. Dennis Long said there was a recent Harvard study showing that the great benefits of a carnivore diet. Then a few months later, they backtracked. Can you say big food, big pharma, big medicine? Who gives Harvard all of its funding, right? Lara says, Dr. Jensen will help you. All is not lost. There is hope. I agree. I'm aiming for 250 and higher for LDL with low inflammation, lots of sunlight. So here's Lara saying, I want my LDL high, because she's probably read studies that show the higher the LDL as you age, the longer your life would be. Lara says, cows have huge livers to detoxify that we may thrive on the meats and fats. Not only that, Lara, I think we've been fed this other crapola that the liver is mainly there to detoxify things. It's not. There are so many things that the liver does that we don't think about. You know, the liver has so many functions. The liver is not working. It's called cholestasis. Stasis means like sluggish or ill functioning. It's not working because of other things. It could be the things we're putting into our body, like alcohol. It could be processed foods. It could be, you know, sugars. It could be the heavy metals. It could be the nanoplastics. It could be a lot of things that are, it could be the iron overload, which is heavy metal. So it's all of these things that could be causing problems for our liver, and we're not thinking that. We just look at the liver as this detoxification, but it's not. It actually makes glutathione. That's for with our immune system. Yakita says, I just believe in trauma doctors and you. Thank you. Yes, if you have a need for a finger need to be stitched back on, you want a doctor to be able to do that. If you want a hip replacement, you want a doctor that's going to be able to do that. Do you need a doctor to fix your chronic diseases? They don't fix it. They put a Band-Aid on things, put you on chemicals, and block biologic processes in your body. If that's what you need your doctor for, I am one. I used to tell people, I said, just put me out of business. Get so healthy that you don't need me. That's why doctors are still in business. They're not changing anything. They're not looking at what the causes are. Lucy says, got to go to the work. I love to learn. Thank you, Dr. J, for sharing wisdom. You're very welcome. Dr. Christie says, Dennis, exactly. It's all about the money, profits, and control. I guess we're talking about big pharma and government and everybody who's in bed with all of them. All the three-letter agencies. Roman says, Dr. Christie, you nailed it. Dr. Christie also mentions pasteurization and iron fortification. I think I agree, those are downfalls to our modernization. Food fortification has corrupted all of our food. And that's how they can call it food. By definition, food has to have nutritional value. If you take an oat from the field and you end up with oatmeal down the line, it had to have been fortified. It was processed so much between the oat in the field and when it became into the box that you picked it up in. That had a lot of processing. That removed all of the natural things that were in that oat, if there is anything that was necessary. And then they call it fortification. That's only so they can put it on the shelf and call it food. Nutritional value. Processed foods have no nutritional value. We fortify them so they can be put on the shelf and be sold as food. Pasteurization is the same thing. You think it helped you with infections? It did not. It made that milk worse. Dr. Christie could probably tell you more about pasteurization if you'd like to know. Lucy says, if you are following a ketogenic diet, what other interventions can you do to optimize your gut from all the years of eating carbs? It will heal on its own, Lucy. You see, we develop microbiome that eat the foods we eat. If you eat carbs and a whole bunch of crappy foods, you're going to have a growth of bacteria that eat that stuff. If you eat a carnivore diet and you're only eating meat, you're going to develop microbiome that eats meat and carnivore, fish, and pork if you want it, and chicken, and anything that comes from an animal. The microbiome will change. People initially, when they go to carnivore, if they go cold turkey, it is hard for some people to change their biome right away. So this would be about the only instance that I would recommend that you take some sort of like a prebiotic, like kefir. So a whole milk, plain, organic kefir. Or you can get a whole milk yogurt, plain, organic. And for every bite of your carnivore meal, like your steak, for the first week or two, you might want to take a spoonful of the yogurt or the kefir. That will help your transition, but you don't need it after that. Your bacteria in your gut will do their thing. They will eat whatever you feed them. They're living rent-free. You don't metabolize anything in your body. The bacteria in your gut do. That's the beauty of it. When you eat corn, you're not breaking that down. Gut bacteria are trying to, and they don't do a very good job. That's why it comes out whole. If you are following a ketogenic diet, okay, I already answered that. Okay. So your gut bacteria will, all the years of eating your carbs and sugar, it'll heal. 2 weeks, Lucy, 2 weeks. And your gut bacteria will have changed, depending on what you're eating. Could you please share what you eat for breakfast, lunch, and dinner? Whoever came up with that breakfast, lunch, and dinner thing? Is that the people who said that you should break the fast? You should get a whole bunch of calories in you. You should just eat multiple times a day. Do you think a lion in the forest or wherever they're at in the wilderness is eating multiple times a day? Where did we get that? Is that a way to make us sick? If you do eat multiple times a day, it's usually crap. And so your blood sugars will go up, your insulin levels will go up, your mTOR levels will go up, you will have no autophagy, you'll never be in ketosis. Those are the downfalls. Do you think you need to be in autophagy? You do. Do you just want no maid service coming into your hotel room after 2 months living there? Autophagy is cleanup service. You cannot clean things up if you are eating multiple times a day. What do I eat for breakfast? I don't eat breakfast. I don't eat a morning meal. I eat when I'm hungry and I stop eating when I'm full. When I'm hungry, I'll eat again. It could be 1 meal. It could be 2 meals. I think there is something said to be fasting. Do I fast in order to lose weight? I don't want to lose weight. I want to feed my body what it needs with amino acids and essential amino acids and essential fatty acids. That's what I want to do. I don't give non-essential stuff to my body. I don't think there's a reason to break the fast. I think fasting is good as long as we're getting enough nutrients to supply the amino acids and essential fatty acids that our body needs to grow big and strong. Muscle is the organ of longevity. It needs amino acids. If you're on a low-calorie diet, I'm not on a low-calorie diet. I eat a lot of calories. I can eat a lot of calories in 1 meal. I can eat even more calories in 2 meals. I go with what my body asks or says I need. I listen. Hunger, is it real hunger? I'm telling you what, on a carnivore diet, when I get hungry, it is real. I know it's real because I am hungry for steak. I am not hungry for worthless carbs that give me no nutritional value and actually have anti-nutrients in them. That's another story in and of itself. We can go down that rabbit hole. If you look at today's modern banana, you think they're so good. And you look at historical bananas, you'll know why these bananas are the fattiest, crappiest, high sugar things we call fruit with a yellow coat, a jacket. So to answer your question, Jackie, I eat meat, eggs, and butter. That's what I eat. Dennis Long says, QQ, with Wild Fork not shipping to Iowa, they don't ship to any state, I don't think, anymore. Do you have a local rancher you go to for your beef? I do not. I have not found anybody yet. Lucy says, is Wild Fork a good place to buy meat? It is, but I don't even think they ship to your area, Lucy. I think they stopped shipping. They're only on the East Coast. Oh, you have one by you? Oh, yes. Wait till you go in there. I think you'll love it, Lucy. Thanks, Dr. J. 2 weeks, great. I am loving bison burgers right now. 2 patties, and I get 62 grams of protein. They're in your bison. If they're pasture raised or they're out in the wilderness, you got to be sure to add more fat, Lucy. You're not getting enough fat. You need at least 1 to 2 grams of fat per gram of protein. Roman says, bacteria is not living rent-free. They actually work hard for us. We just have to get the right ones on the bus and the wrong ones off the bus. Good point, Roman. I like that thinking. Lucy says, I'm eating 100 grams of fat per day. Does that mean you're eating 100 grams of protein? What is your body telling you? Is that 100 grams enough? That's only 900 calories. How much protein are you getting? These are good questions. I like these questions. I see the people over on YouTube are still fighting and bickering between each other. It's comical over there. I'm sorry if there's people over on YouTube that have legitimate questions to be asked. Maybe you can message me privately and I can help you answer them. 120 grams of protein, 100 grams of fat. Okay? Lucy, I would encourage you to increase your fat intake. If you are menopausal, I would encourage increasing your fat. Fat is good for you. Saturated fat is good for you. Polyunsaturated fats that are found in processed foods are not good for you. Your cardiologist will tell you the opposite. They'll tell you to eat a bunch of canola and safflower and sunflower and grapeseed and cottonseed and corn. They'll tell you that those oils are good for you. Why? Why? Because they lower cholesterol, as if cholesterol is the problem. Do they know that polyunsaturated fats have multiple double bonds? And it's the double bonds that cause and lead to oxidation, in this case, peroxidation. Are they well aware of what peroxidation, oxidation, free radicals in your body is doing to you by eating polyunsaturated fats? Do you think that your cell membranes can work properly with polyunsaturated fats versus stable, no double bond saturated fats? No, your doctor doesn't know that. They don't know anything about polyunsaturated fats having double bonds that get oxidized and cause stress and free radicals in your body. I don't think they know that, or else they would not have given you that recommendation. But if the answer is to lower your cholesterol, good, yes, polyunsaturated fats do lower your cholesterol, as if you don't need it, as if that is the cause of your heart attack, when in reality, your polyunsaturated fats that you're eating with the double bonds that are unstable, causing peroxidation, is a problem with coronary artery disease, inflaming your vasculature and causing an injury, leading to plaque formation and clot formation and decreased blood flow. I think we got it backwards, you guys. I really do. I hope that more doctors will wake up. There are cardiologists who are on board with Dr. Ovadia, Dr. Malhotra, Dr. Malcolm Kendrick. All of these doctors, they seem to be on board. Why do we need, I've had it, even when I get done with this type of speech or lecture, I'll have people say, well, how can I naturally lower my cholesterol? My question back to you is why? Why do you need to lower your cholesterol? Why? I don't ever get answers to that question. Are eggs good again? My cardio said no eggs. Are you referring to your cardiologist? Why? Why are eggs not good for you? A chickie will grow inside an egg and not need anything except for her mama to sit on her to keep her warm. That chickie will feed off the yolk and use the white, the albumin, as an anti-infective. That's how they don't get infections inside there, and then they get all their nutrients from the yolk. It is 100% bioavailable. What is it about the egg that your cardio tells you no eggs? I'm asking a question. Are eggs good again? No, they've always been good. Lucy says, I want to buy a half a cow. My friend will buy the other half. Just need to get a freezer. Go for it. Lara says, eggs are superior foods. They have 4 to 6. I have 4 to 6 per day the last 5 years. Because of the, so Aram says, because of the cholesterol. What? Again, my question is, what is wrong with the cholesterol in the egg? Look at the amount of cholesterol in the egg, and then go look at the packaged food that they told you to eat and see how much cholesterol is in it. Why is cholesterol a problem? Be aware that the food that was packaged, that's processed, will show cholesterol, but that is not animal cholesterol, that is plant sterol. We cannot incorporate plant sterols into our body. That is not the cholesterol our cells need. We are an animal, not a plant. We need animal cholesterol, not plant sterols for our cells, our cell membranes, or anything that we put in our body. Half the medicines, or a majority of medicines, are from plants. Yes, some from minerals. I realize that. But most of them were developed from plants. Dennis says, Lucy, agree. I do prefer YouTube. Too much garbage in the chat. If you get a freezer, make sure you get an upright one, as with a chest freezer, the meat you want will be on the bottom. Good point. Just things to think through. Dr. Christie says, when you eat a burger at a restaurant or chain, that meat came from thousands of cows. True. And so a person who buys meat from one rancher usually just get all one cow. Well, hopefully that one cow is good. Live with meter and no measure. I can't handle the yolks. I was on antibiotics for years. They mess with my stomach. Is it the yolk or the whites? Did you separate them out? Did you just eat the whites? Did you just eat the yolks? What is it in the yolks that mess with your stomach? Looks like that is all of the questions. I'm not entertaining questions on YouTube. At some point, those people will just disappear. Lara says, fire your cardiologist. They all say low fat, low salt, and heart disease continues to increase. Yeah. Ooh, Roman asks a good question. Talk to us about creatine. Well, this is a controversial subject. I will say this. If you are eating a meat-heavy diet, I believe you will get enough creatine in your diet to supply your needs. There are people who may not get enough amino acids from meat in order to supply enough creatine. Could you go and take creatine? Yes. Creatine monohydrate. I don't necessarily recommend creatine HCl hydrochloride, but some people can't tolerate creatine monohydrate. It is a few amino acids. If you were to talk to Dr. Christie about this, she would tell you that glucoferrin would be a better option than creatine, because creatine is synthetic. The ones that you're consuming, it's not from the original source, which is the cow or the bison, buffalo, sheep, deer, lamb. And that taking glucoferrin, which is 708 amino acids instead of just a few, that creatine is basically not so much for the amino acids as it is for ATP production. It's donating a phosphate to ADP to make ATP. So creatine monohydrate is giving you a phosphate group to increase energy production. Can you get that simply from eating a meat healthy diet? Yes. So I guess it's up to you. I think you're wasting your money. Some people will say that we are very, very low on creatine, and that for longevity of our muscles, for our brain, especially for elderly, that we should be taking more creatine. I would say evaluate your diet. Make a decision that's based on you. Talk to Dr. Christie. You know, maybe she can describe more the benefits of glucoferrin, which is a nutraceutical. It's not a supplement. It's not considered a supplement. Lara says, eggs will bother you for a while, and so will eating this way. It will change over time. May take months to adjust. Keep going and add eggs later. Yes, I am live on Instagram, and I am live on YouTube right now, in case you guys are wondering. Okay. I believe that is all the questions that I have on here. And so we will call it a day. I appreciate you guys listening in. If you have further questions, don't hesitate to email me or message me, and I can go over some things. If you're interested in a consult, you can email me or message me. The email is IronLadyDoc@AOL.com. If you have just, a light amount of questions or one or two, and you say, hey, can you reinforce blah, blah, blah that you talked about? That's awesome. I can try to help. If it's too complicated or I think it requires more time, I will suggest a consult. If you're interested in getting labs, your doctor will not order them for you. I can order your labs as long as it's in the United States. I can order your labs. The unfortunate thing is your insurance company, or the lab I use does not take your insurance. They don't take anybody's insurance. It's cash pay only. It might be worth it. It might be worth it to you. But if you need a list to talk to your doctor about, email me or message me, and I can give you a list of what I think are good labs to obtain, at least for the first time. That could run you, $350. There's cheaper versions, of course. I don't have to, run or you don't have to run everything. I'm not running it. I'm just suggesting certain labs. So if your doctor won't and you are able to pay for those, ask me and I will give you a list, and then you can get them wherever you'd like. If you want your doctor to obtain them, great. If they won't order them and you want me to order them, I can order them for you. And it's simply, basically, I emailed the cart, like an Amazon cart. It's called Alta Labs. I email the cart to you. You pay for the cart, and then you will go to the draw station of your choice, and you get your blood drawn, and then you get the results. If you want me to help you go over them, I will. You just have to ask. Okay? So contact me if you want your labs done, and your doctor won't order them. Or you don't even want to go to your doctor and say, Dr. Jensen, just order these for me. I'm good with it. Dennis says, Chop Local looks like it has promise for listing local farms and ranches. Good piece of information. Thank you, Dennis. I appreciate that. You guys are very welcome. Have a blessed day. You guys have a blessed day as well. And tomorrow looks like Learn in Lifer. Please ask that question tomorrow and on magnesium, and we will do that. So I am live Sundays at 10 a.m. Central. So you guys from